Basically what we see here is the crystal structure solved by Professor Wyatt Yu and his team from Oxford University that we got for this project, which is myself from Pepticom and Dr. Orca Chlon from Adasa. And we can see here what the wild type glycogen branching enzyme looks like. The mutated glycogen branching enzyme, there's a little hole formed right here. And this hole is not in the active site, or not nowhere near the active site of the glycogen branching enzyme, but it creates a destabilization. When we talk about the normal glycogen branching enzyme, it vibrates much less than the mutated one, and this vibration causes the enzyme to become inactive, possibly through ubiquitin system that recognizes the protein as misfolded or wrong. And what our computer algorithm designed is this small peptide, which basically fills this hole and forms a very nice hydrogen bond pattern, which stabilizes this whole region in the mutant protein. So in effect, we can get this hole, which does not exist in the normal protein. When we take this small peptide and introduce it to patient cells, what we can see is that A, it penetrates the cell membrane via active transport, so it actually reaches the enzyme, doesn't stay outside of the cells, and B, that the enzymatic activity in the patient cells is partially resurrected. So when we have patients without the peptide, we see very little to no basal GBE1 activity. Of course, normal volunteers have a very high GBE1 activity, whereas with increasing dosage of our peptide, we see, and increasing time, of course, we see that partially the GBE1 activity is resurrected. Another interesting thing that we saw is that for the first time you can actually take the glycogen branching out of patient blood. When we try to extract GBE1 from patient blood and then detect it via Western blot, we see that either with a random peptide or no peptide, we cannot detect a visible band of GBE1. Of course, the healthy volunteers have a very large amount of GBE1, but for patients treated with the LaTKE designed peptide, we for the first time can design a basal level band. We also see that there's a dose dependence to the binding of GBE1, and that via various mutations and atomic alterations, we can see that indeed the binding mode is similar to the one that we see here. So these experiments pretty much validated that this peptide actually stabilizes GBE1 in patient cells, and now it serves as a drug candidate for actually reversing the adult polyglucosan body disease mutation of Y329S. So we hope that when we introduce this peptide or derivatives thereof to patients, they can actually start regaining the glycogen branching enzyme activity that they did not have since birth. And since they survived for 40 years without any residual or very little residual GBE1 activity, we hope that once they get a significant amount of GBE1 activity, their disease progression will hopefully stop, and possibly even reverse itself to the point where their physiological function becomes more like young people again. We believe that this mechanism is the first time a computational method is used to correct a genetic disorder, and we believe that using this method we can actually resurrect much of the glycogen branching enzyme activity whose loss causes adult polyglucosan body disease, and by resurrecting it we could possibly even bring the patients to the level of a cure.